Hi, okay, welcome to my presentation. I am going to be discussing auditory impairment, either temporary or permanent, and health concerns associated with that. So, to start, a description of the population that might experience this. Hearing loss can occurs when any part of your ear doesn't work properly. So that can be your inner ear, it can be your middle ear, it can be the nerve going up to your brain, or it could be your actual pinna and the external structures of your ear. Any of those, trouble with any of those can cause a hearing loss. And it can occur at any time in your life. You can have congenital hearing loss. You can have hearing loss that occurs from trauma or from excessive exposure to noise over a long period of time. Or just as part of the aging process. So the size of the population, locally, I couldn't find any solid statistics for right where I'm at, but with my own personal experience with a daughter with hearing loss, we have gotten to know a lot of people with the Utah Schools for the Deaf and Blind in the area, and some other resources located at Utah State. So there's a lot of resources in this area for people with hearing loss, or people that are completely deaf. Statewide, the percentage of adults with hearing loss is 15.96%. And nationally, I found that 2 to 3 out of every 1,000 children in the U.S. are born with a hearing loss. And then 2% of adults have disabling hearing loss in the nation. And then talking about the whole world, there's about 466 million people worldwide that suffer from disabling hearing loss, which I didn't realize the number was quite so high. So different factors that may contribute, social factors. Age is a huge one. So the age at which a person is diagnosed with their hearing loss, it can be, hopefully, if it's a congenital hearing loss, it's caught with their newborn screening that's required now. Or it could be something that develops later in life and that they find out, down the road that they had a hearing loss for so many years that they just were unaware of what they were missing. So that's a huge determinant of their social health, is when they start getting help for their hearing loss. Cost of hearing aids is a huge one. From my own personal experience, like I said before, with my daughter with hearing loss, she's 5 months old. She got her hearing aids at 1 month, and they were $3,000, which I was just shocked at the price, and I can see where that would be a huge deterrent for some people who might not have the funds to be able to spend that much on hearing aids. There's also a stigma that some people feel is associated with wearing hearing aids, just feeling different from others, or feeling ashamed that they can't hear as well, or that they can't do the things that people with normal hearing can do without assistance. And then different lifestyle choices affect social health. So things such as tobacco use can affect our health in a number of ways. And then exposure to loud noise without use of hearing protection is a big one that causes hearing loss to develop in people. And this is, could be someone who works on a job where there's lots of equipment and things that's loud, and that's just what they've done their whole lives, and it causes them to lose their hearing. So some contributing factors and specific concerns. Children with hearing loss, if they don't catch it early and they don't address it quickly, can end up with many different delays. So the main ones, especially with congenital hearing loss, is that they won't develop speech and language appropriately. And this is what we've got to experience with my daughter, is we have to be very diligent about her wearing her hearing aids and making sure that she is meeting all her language milestones. And I think that's something that most people don't think about with a 5-month-old baby, is that they're developing language from day one. And so it's super important that that hearing loss is caught and that we intervene quickly. It could also cause a social and emotional delay because they won't be able to pick up on those same social cues that we all can with normal hearing. And then adults who have an untreated hearing loss might feel isolated from others because they can't feel as included in a conversation or about whatever's going on because they can't hear, they can't get the full context of the situation. And they might have other health needs that aren't taken care of. If they're unable to treat their hearing loss, whether it be because hearing aids are too expensive or whatever their reason, that could also mean that they have other health concerns that they aren't addressing for the same reasons. And they might also find that they aren't as successful as in their professional life, at work, or in school as they'd like to be. And this comes down to also being unable to hear and communicate appropriately. So root causes for hearing loss. We have quite a few biological causes. There could be genetics. It could be an infection that caused it. It could be a drug sensitivity. I know we learned in nursing school about the antibiotic vancomycin being ototoxic. And so that's something that could cause a hearing loss or tinnitus for a long time. Age could be, like I've kind of gone over a lot, a congenital hearing loss, or what we see most commonly is hearing that decreases as we age. And then physical injury, whether it be, injury to the eardrum would probably be the thing we think of the most, that would cause a conductive hearing loss. And then there's those environmental causes that we talk about most, and that being loud noises and no ear protection. So when thinking about Maslow's hierarchy of needs, those with a hearing loss shouldn't be prevented from accessing things like food and air and water. So they should be able to meet that bottom tier of the triangle. But unmet needs could start at just the second tier up at safety, because one of the things that we need to have is the safety of employment. And we discussed this in the previous slide, that some adults who don't have treated, or whose hearing loss is untreated, might not be successful in their employment endeavors, and that leads to them feeling unsafe. And we know you can't move further up Maslow's hierarchy of needs till we meet that. So it's pretty important that hearing loss gets treated. Without treating it, their functioning level can, depending on the level of hearing loss that they have, can be pretty low, and it could hinder them pretty significantly socially if they don't have the resources to be able to communicate. Health outcomes they may experience. They may have a developmental delay and emotional distress if their hearing loss isn't treated. That's why early intervention leads to such positive results. And children, like my daughter, who have hearing loss, but it's treated from an early age, depending on the level they have, like my daughter's hearing loss is mild to moderate. And so with her hearing aids and with us watching to make sure she reaches her milestones, she should develop right alongside her peers and have no trouble, which is the goal for any child. So some specific concerns when talking about disease. People with hearing loss aren't necessarily more likely than just the average person to experience any communicable or non-communicable disease. When we think of ears, I think people often ask, well, if you're wearing hearing aids, are you more prone to ear infections? And that's not necessarily true. Ear infections are just common in childhood anyway, but they don't normally lead to a permanent hearing loss, just usually temporary impairment until it can get treated, whether it be tubes or whatever the doctor decides. And that's ear infections are generally not a communicable disease. Something that does cause hearing loss that it would be communicable is cytomegalovirus. It's a virus that doesn't normally cause any issues to people who contract it. So most of the time you wouldn't even notice. But if a mom contracts CMV while she's pregnant and passes it to her baby through the placenta, it can cause congenital hearing loss. So this is something that is screened for if babies fail their first 2 hearing screenings at the hospital. And the best way to prevent this is proper hand hygiene. There's no vaccine at this time for cytomegalovirus. So specific concerns for self-care, self-harm. I found some statistics reporting that adults have a higher incidence of depression, adults with hearing loss. 11.4% of adults with hearing loss report experiencing mild to moderate depression. They might also feel socially inept, which can amplify this problem. They feel like they miss parts of the conversation that are key. They talk too loud or out of context. They aren't able to follow the topic of the conversation, and worry that they appear rude for how they respond. So some resources I found on the CDC's website for interventions for those who might need some social services for, if they're feeling depressed or suicidal, or just support for their family, and maybe they have a child with hearing loss. So I just listed a few of those here. The Alexander Graham Bell Association for the Deaf and Hard of Hearing, Bright Futures at Georgetown University, and Family Voices. And these all seemed like great resources for support for those who would need it. And then for harm by others, I found a interesting journal article about maltreatment of children with hearing loss. And this was actually done in like a lower income area with an Aboriginal community in Australia, and it was found that children with hearing loss had a greater incidence of abuse and neglect than children who were normal hearing. And so the study suggested that there is a need for greater abuse prevention strategies and community awareness of the issue. And I know this is something we talk about a lot. This is why we educate the public as much as we can on issues like this, so that we can help educate families on how to have coping mechanisms that are healthy and help them be able to take care of these children. So yeah, that's my presentation on hearing loss. I hope that was informational.